Welcome to Velocity, the Vista Chamber podcast. I'm your host, Rachel Beld, and it's my privilege to interview the movers, shakers, and change makers impacting the Vista community and beyond. Today, I am thrilled to have two guests with me. Both are healthcare providers with Vista Community Clinic. VCC is a community health clinic started in Vista 50 years ago, and now they serve more than 70,000 patients per year. First, I'd like to introduce Dr. Diana O. Ponsford. She's a board-certified doctor in family medicine and is an HIV specialist. She's been with Vista Community Clinic for 5 years, where she practices family medicine for adults, HIV medicine, and gender-affirming care. Dr. Ponsford is a Southern California native. She attended medical school and completed her residency in the Pacific Northwest. Also joining us today is Joanne Goode, who is a family nurse practitioner at Vista Community Clinic in the Grapevine location. While she's been with VCC for 14 months, she has over 20 years of experience in nursing with 7 years in advanced practice. Nurse Practitioner Goode sees patients age 12 to 100 plus in primary care and GYN services. She's currently specializing in medication-assisted therapy, MAT, for patients with substance abuse diagnoses. Born and raised in Philadelphia, she began her career as a labor and delivery nurse. Welcome, ladies. Thanks for being here.
Thank you. Happy to be here.
Okay, so first of all, Diana, may I call you Diana?
Of course.
Okay, thank you. I'd like to ask you, what led you to healthcare and patient care?
So as a child, I never really thought, hey, you know what, I'm going to be a doctor. It was sometimes crossed my mind, but as a kid, you're pretty flippant sometimes. You're like, I want to do this. I want to do that. I think going into college, I really focused it on biosciences. I worked in a clinical lab for the majority of my college years. Towards the end of my college time, I had this opportunity to be in a clinical laboratory position versus going to med school. As I was interviewing for the lab position, the man who was interviewing me actually told me, hey, listen, if you were my daughter, I would tell you that you would most likely regret not going to medical school. So he obviously didn't know the influence he had on me that day, but thank you if you're out there. It changed my life for the better.
I love that. It's so interesting that the people that we meet along the way, you never know the impact they have on the decision that we made.
Absolutely.
And you can look back onto certain points in your life and say, that was a pivot point that led me to where I am. And that's really cool that you have. I'm assuming that you met him that one time.
That's it. He probably has no idea how much of an influence he had on me at that point.
That's such a cool thing. Yeah. And also to think about all of the people that you've touched and impacted and how you've had a pivot point for them. It's kind of cool to think about. That's really cool.
So I was in medical school, and in medical school, we have this opportunity to choose from all these different specialties, right? In our last 2 years, we do our clinical rotations in different electives. I ended up choosing family medicine to go into. So in my residency in family medicine, I worked with 2 providers during that time, 2 wonderful, excellent clinicians that it helped me along the way to see patients living with HIV and to see patients that needed gender-affirming care. I fell in love with that patient population, and that's what I've been doing ever since. I worked at an FQHC over in Washington, and when I was moving here to San Diego, looked for something with similar attributes and also in the place that I wanted to live, which is where my family's from.
So what about you? May I call you Joanne?
Yes, please.
Okay. And tell me, how did you end up in the career where you are now? It didn't start that way, right?
Well, it kind of did, but didn't. So
Okay.
I graduated from high school and went to nursing school. It was a diploma program, but life happened. I had my second child, so I had to stop school. And I went to my other passion, which was cooking. So I went to culinary school, got a culinary art degree, worked in restaurants, but there was a nagging for me to go back into nursing. And so after about 10 years of doing something else, cooking for restaurants and private chef, I went back to nursing school. So, and then that's how it started.
And you started in labor and delivery.
I started in labor and delivery. I lived in Pennsylvania. I did home health. I did case management for an insurance company. I was a director of nursing at a skilled nursing facility here. in Southern California. But I just thought that, with all this years of nursing experience, the best way for me to help would be to get into primary care. So I went back to school here at Azusa Pacific. They have a satellite in San Diego. It was nice, a brick and mortar school. I could go to school. And I got my master's as a nurse practitioner, and that's it.
How did you end up at Vista Community Clinic?
So as I progressed in my career as a nurse practitioner, I was actually with the FQHC, which is Federally Qualified Health Center out in Imperial County. The other company is also very similar to VCC, providing services to underserved patients. And then after being there for 4.5 years, and my base being here in San Diego County, I really wanted to come back to the area. And then I looked to see what VCC had to offer. And I had actually been a patient of VCC once upon a time.
You were?
So, yeah.
That's great. I love that.
So I had been a patient. I knew the level of care that they gave to patients and the comprehensive services. So it was a no-brainer.
So for people who don't know, what is the difference between a nurse practitioner, and an MD? Like, what's the difference?
Thousands of dollars.
Yeah. Wait, in cost or in pay? Both?
In both. So as an RN, as a nurse practitioner, I am an RN. I still am an RN.
Okay.
However, I've obtained more education. So I have a master's degree with advanced training, which allows me to do some similar things that physicians do. I think one of the things that differentiates physicians from nurse practitioners is that nurses are always nurses, and we care for patients. While there's a medical or medicine perspective for physicians, whole patient care and patient interactions and patient education is kind of the focus with nursing.
Okay.
So it allows me to do kind of a hybrid of both things. While, yes, I continue to treat the whole patient, I can also add the medical route into it.
Great. That's
I
great.
think so. I think also a little bit of that difference comes along in the training aspect, because you're all trained very differently than us. You get your clinicals as being an RN, you know what I mean, and all that training. And what we do is we do that formal med school, and we do clinicals the last 2 years, plus we add on a medical residency on top of it for a specialized field.
So different education, different experiences, but it's interesting to see how medical offices are using different levels of education, different levels of patient care to treat patients in different ways and to see, I mean, obviously there's a large volume of patients that come through and they need care in different ways. So that's great that VCC can utilize people with different backgrounds and different skill sets. So that's great. Tell me, you mentioned an acronym, federally.
FQHC.
Yeah, so tell everybody, what does that mean?
Federally Qualified Health Center is kind of like a community clinic who services patients who are primarily underserved, underinsured, or uninsured. And those patients, we typically get most of our funding from CHS or CMS, which is like Medicare, Medi-Cal, and those kinds of
So federal and state funding,
right,
probably.
Correct. And I think also like the Federally Qualified Health Center is not something that's just specific to California.
Right.
So it is a nationwide type of thing.
It's a way to provide healthcare to, like you said, the underserved, underinsured or uninsured folks who need healthcare. Everyone needs healthcare. Everyone has a right to healthcare, right?
Yeah.
So that's great that Vista Community Clinic can provide care to those who need it the most. And has been doing that for 50 years. So that's super cool. Over 50 years now. So, okay. Dana, in your bio, we mentioned gender affirming care. And so I know people hear that term. What exactly does gender affirming healthcare mean? What does that mean?
Oh, it means a multitude of things. So from a patient who doesn't necessarily identify as the sex they were assigned at birth, right? It's a place for them to come in for not only primary care, but to help with any transition they need, to help with any referrals they need. It's full encompassing care.
And does that include physical care, mental care as well?
Absolutely. Absolutely. So the entire person.
Okay. And so when people think about gender affirming care, is that only for folks who are considering transitioning, or could gender affirming care also be things that help someone affirm their own gender that they want to?
I think it encompasses both. I think like some of my patients are not on your typical hormone treatment programs to help with transition. Some of my patients identify as non-binary and aren't on any hormones, but they also need a provider who sees them as a person and not as
one gender or the other.
Yes,
right.
exactly.
Okay. Great. Well, thank you for answering that. I appreciate that. Why do you think it is so important for folks to have gender affirming care?
Again, I think it's really important that people understand that everybody is a person, right? We all have the right to health care, regardless of if we identify as female, male, transgender, gender non-binary, gender fluid. We are all people and we deserve that same type of care.
May I
Please jump in.
I think that there's still so much bias associated with
Absolutely.
People not conforming, as you will. And so with our gender care, it's just kind of a safe space, I think.
Absolutely.
I think it's a safe space. We have behavioral health services involved, as well as our physicians who provide the care. And I just think that is the part that is the most important, is that it's a safe space.
Yeah.
And I will say that VCC not only offers gender affirming care services to adults, but also pediatrics.
Okay. And I think people often think of gender affirming care as being just changing your appearance. So can you give me a little more specifics about what else that entails?
It's so much deeper than that. It's being comfortable in oneself, and whether that be through public appearance or whether that be through, changing of the hormones, changing your dominant hormone, because as you know, when we're born, right, we are assigned a certain sex at birth. And with that assigned sex at birth, we have a dominating hormone in our body, right? So what happens is what you appear as on the outside may not necessarily be what you are on the inside. Right? So gender affirming care is in order to come to a place to feel safe, to feel comfortable being whoever it is you are.
Well, I think everybody wants to feel safe and however they are and be accepted for what they are and who they want to be. So I think that's great. Can you tell me a little bit about the work you're doing with HIV care? So what does that entail?
So HIV care in our world, in the family medicine world, it covers primary care for HIV. So it's not just people that are living with HIV, but it's also people that are living with HIV plus have X, Y, and Z. Things like diabetes, high cholesterol, high blood pressure, all of those things in addition to living with HIV. So at our clinic, we offer medication services, right? So primary medication, because as of right now, there is no cure for HIV, but it is very treatable. So the goal for HIV medicine is so that you can live a normal life and die from a cause unrelated to your HIV. Okay. We also offer things like HIV prevention services. So for people not living with HIV that are having sex or exposed to HIV, we offer medications such as PrEP to help them from getting it. We offer post-exposure prophylaxis. These are things like if you've been exposed to HIV or think you've been exposed, there's a medication you can take to help you not get it. Okay.
That's great to know.
For our patients living with HIV, we do have a full-on case management program. This covers social work. This covers counseling and therapy. We have legal aid. We help with housing. We offer services to those who are not insured. We get grant funding for a program called Ryan White, which is full encompassing HIV services. They don't have to pay a dime out of pocket for it. We offer sliding fee, which means that they can come in and pay a certain amount of money, and we can do all of the healthcare things they need. We also provide care for people with Medi-Cal, for people with private insurance. So we have all of these services kind of in our system.
Well, it's great to know that all of those services are available, because that's not something that, you're just walking down the street and where to go if you've been exposed, or if you have a question, or if you have a concern, or if you're living with HIV and you need help. You don't necessarily, it doesn't seem, at least I feel like I'm a layperson in this regard, and I didn't know that Vista Community Clinic offered those services.
Absolutely.
Which is part of the reason you're here today. So,
absolutely.
Yeah. So thank you for telling me about that. I want to ask you about medication-assisted therapy. What is that? What is it?
Okay,
Tell me more.
Medication-assisted therapy is just kind of exactly what that is for people who have substance abuse disorder. And when I say substance abuse disorder, that's exactly how we treat patients who have addiction issues. Substance abuse disorder is a chronic medical condition. And so what we do is we use medications to help patients get off of opioids, treat patients who have addictions to nicotine, who have addictions to alcohol, benzodiazepines. And there's ongoing training and ongoing therapies for those types of patients. So we treat those patients and help them to maintain sobriety.
That is life-changing. I mean, all of the things we've talked about can really be life-changing for people. But so basically what you're describing is someone has, they're dealing with substance abuse or addiction. They can take different medications. They can take medications to help them not take or use these other more dangerous drugs, alcohol, nicotine, all of that. Yes. That's amazing that we have that available to people because that can be the difference between people living kind of a healthy, normal life and not.
Yeah, I am often in awe at how I see patients when I first encounter them. And then months into therapy, how their lives have improved, how their lives have changed, and how many times patients are so grateful for the opportunity to be on medications for treatment and not have those addictions interfere with their lives.
So I would assume that this therapy that you're providing is also in conjunction with other therapies and that are maybe non-medical, maybe mental health therapies and other programs. Are they used in conjunction with those things?
Yeah. So what we do as a part of our program, there are some contingencies. So part of the thing is that patients must use a substance abuse counselor. And then we often encourage AA and NA. We do have one of our nurses at Grapevine who, and one of our therapists who helps with a weekly meeting. So patients of ours or even people in the community are welcome to come to the meeting, and it's kind of like a AA meeting for our patients, and it's available for them too. So cognitive behavior therapy with the therapist, medications, NA, AA. We often try to incorporate patients' families into the program too.
Wow. Well, it sounds like the programs that you've both described treat the patient medically, but also there's all of these wraparound services and supports that are available. Is that typical for programs like these?
It should be.
Yeah. Do you think Vista Community Clinic is doing it differently or better than others?
I think they're doing a great job at having those wraparound services. I can't speak to how other clinics are doing it or organizations, but I think that Vista Community Clinic for sure is doing a good job with that, with the wraparound.
I think we're doing an outstanding job with our MED program. And I can say that because of the resources that we have in the community and how our patients are funneled into the services there. And not a lot of clinics in North County are doing these particular services. There are some other clinics in other parts of the county who are offering these services. But as far as North County, with it being this comprehensive of a program, Vista Community Clinic is doing an outstanding job.
How do patients find you for any of your programs, either of you?
LGBTQ Center. We get the county, some hospital discharges, word of mouth, referrals from other clinicians within Vista. Can you think of any others?
VCC appears on a state database for MAT services. We get a lot of patients funneled in from corrections, and we work really closely with a lot of the residential outpatient services in the community for patients with substance abuse or patients who have been changing from inpatient substance abuse to outpatient substance abuse. So we get a lot of those referrals into our program for that as well.
That's
Absolutely.
great.
And I think that some of our clinics are really close to some of these recovery centers. For example, I work at a clinic in Oceanside, the Horn Street Clinic. We're right across the street from a recovery center. And oftentimes we'll get people coming over here to our office, just walking over for general physicals. Oftentimes we find that they may need MAT. And so we can get them scheduled with people like Joanne over at Grapevine for that.
That's great. What's the best part of the work that you do? We'll start with you, Joanne.
I think for me, seeing the transition of patients. So even outside of MAT, even with primary care, for me, the reward is seeing the patient go from a place of disease to health and wellness. And so watching a patient be able to manage their comprehensive or complex condition, such as addiction or diabetes or any other chronic health condition. So watching patients become confident in their care and transitioning from being the sickest of the sick to being better or having that condition controlled. That is the reward that I get. It makes me really feel good about what I'm doing. I find it to be, and I say it out loud, it sounds kind of corny, but it's kind of a blessing for me to be able to infiltrate people's lives when they're their most vulnerable. And it allows me to see the transition. And that's the blessing.
Yeah, that's great. What about you? What's the best part?
Honestly, I would say it's very similar to what Joanne's saying. It's seeing them come back to health and seeing them be confident in themselves and also self-aware of what is going on with regards to if they're living with HIV or if they are finding that there's been a lot of bias with who they are as a person. Seeing them become comfortable and confident, I think it feels good.
Okay, so on the flip side, what's hard about it? What's the hardest part of your work?
Honestly, it's the incurable disease aspect of it.
Yeah.
It's the patients that succumb to the illness. It's seeing that there's still a strong bias and stigma out there. Yeah.
So it sounds like you really care about your patients.
Yeah.
Yeah. And you probably, if you see them, you know, if you're not seeking care regularly, you see your doctor for your annual physical and that's it. It sounds like the patients you see, you probably see a little more frequently, at least sometimes.
Absolutely, especially in the beginning.
Yeah.
In order to build that relationship and for them to build their trust in me as well, we need to see them very frequently. For my patients who are newly diagnosed, I see them every 1 to 2 weeks. And then thereafter every month and then every 3 months. You know, it never goes beyond every 6 months for any of my patients.
Yeah. And what about you? What's the hardest part for your work?
Again, the hardest part is seeing someone in the MAT program relapse repetitively. I think not being able to see patients improve. The non-compliance sometimes can be hard. And it's so multifaceted why people are non-compliant. And I wish that our healthcare system was a little bit more encompassing, because my greatest sadness comes from not being able to help a patient because they don't have insurance, whether or not it's because they're undocumented or whatever the reason. They make $5 too much annually to qualify for a program. The frustration is somebody's needs my services, they need help, and I have to refer them out, but we can't refer them out because they don't have insurance or money to pay for those services someplace else. So one of the really cool things that I like about VCC is that we do have some specialties there, which alleviates that. But when patients need things like surgery or something different, it's really kind of heartbreaking when I can't really give them the services and help that they need.
Absolutely.
Yeah. So you care deeply for your patients, both of you. That's so important. What do you want people to know about, because all of the things we've talked about today have bias or stigma associated with these conditions. What do you want people to know about your patients? Like if you could say, hey world, this is
your family member.
Yeah.
This is your auntie, your uncle, your little brother or cousin. These are people.
This is a human being.
This is a condition. This is a medical condition.
Absolutely.
But it doesn't stop them from being the person that you love. It doesn't stop them from being your family or your neighbor. It's just really kind of just treating people like people, regardless of their medical diagnosis.
Absolutely. Absolutely. Get rid of the bias. Get rid of the stigma. People are people.
And just have compassion and kindness for everyone around you.
Choose kindness.
Yeah.
Always choose kindness. My gosh, that's what I tell my daughter every day.
Same.
Choose kindness.
It's free. It doesn't cost anything to be kind.
Yeah, absolutely. So is there anything about Vista Community Clinic specifically that you think that people should know? We're going to link to all of these programs in the show notes. So if anybody listening is interested or needs to know more about any of the things we've talked about, we'll link to that in the show notes. But is there anything about Vista Community Clinic that comes to mind that you really want people to know? Hey, we're doing this.
Sure. So in addition to our HIV services, our MAT services, our gender affirming services, our primary care, We also run an STI clinic every Wednesday afternoon for testing treatment. I run it myself. We dedicate about an hour every Wednesday afternoon for that. Hepatitis C, we offer that treatment there. Yeah.
We have a mobile unit that's out in the community.
Yep.
I really enjoyed my time working on the mobile unit. It's really great and helps services to be accessible to patients in the community. I think our Women's Center is top notch. We've got some really great services over at the Women's Center.
Where's the Women's Center?
It's at the Vale Terrace location.
Okay. The main, kind of the main campus.
Just down the street from here.
Right.
Yes, the main
But
campus.
most of the clinics offer some limited GYN services. I think our optometry and dentistry help us to stand out in the community. I love the fact that there's a podiatrist and a cardiologist and physical therapy and acupuncture. I love that those services are available. So,
Absolutely.
And I learn more about VCC every day about things that we have available that I didn't even know that was available at the food bank. And I mean, there's so many wonderful things. So,
I think it also takes a really dedicated person, clinician, to work at an FQHC. Burnout is real at FQHCs, just because of the number of patients we have to see and the number of conditions we're treating. Because a lot of these people don't have access to a ton of healthcare, so they're finally coming in to see you. So I think you're going to find really caring, compassionate clinicians at Vista Community Clinic.
That's great. Well, and it's also great if someone isn't going to the doctor as often as they should. It's nice to know that they can see the eye doctor while they're there. They can have someone look at a podiatrist, look at their foot. They can schedule physical therapy. I strongly believe that our eyeballs and our teeth, it's part of our body and it's part of our health and our brains as well.
Absolutely.
So we should have those things looked at by doctors regularly, and it should be something that's available and covered for folks. I mean, you can't, you need your eyeballs, you need your teeth, you need your brain. Those should all they shouldn't be treated separately from the rest of our bodies, in my opinion. So I'm really glad to hear that Vista Community Clinic is offering that. And that they have services for folks without insurance. That's a really important piece.
I think also something that VCC does is they do an internal medical assistant training program.
Oh, okay.
So I just had, a patient tell me the other day, hey, I just signed up for the medical assistant training program. And I was like, yes, that's awesome.
Yeah.
We're building bridges for jobs as well.
That's an important piece because, career pathways are really important. At the chamber, we work really closely with our school district to try to connect students and education. And we actually featured one of your medical assistants on one of our workforce development websites that we do.
Awesome.
So I'll tell you more about that offline. But maybe you know this gal. But that's fantastic that Vista Community Clinic not only is investing in patients, but also in workforce. Because we need talent in order to continue to serve patients. Our population continues to grow and people need services. So that's fantastic. So if somebody listening needs health supports, again, I said we'll link to it in the show notes, but do they call? Do they email? What do they do?
Okay, so definitely can call. Because of the volume of patients we see, call center gets pretty backed up sometimes.
Okay.
So it can be a little bit discouraging. However, just stay on the line. The other option is to walk into the clinic. We're usually really good about getting a patient tucked in and getting them appointments in the not so far future.
Okay, so it's not a situation where you're calling and then your appointment's in 9 months.
No, absolutely not.
Yeah.
I have patients who leave corrections and I see them the next day.
Okay.
I have patients who are seen in the emergency room because they've gone through withdrawal. They've been started on certain medications and the follow-up is with me within the next 2 to 3 days. So definitely there isn't a super duper long waiting list for those services.
That's great. That's great to know. Okay. All right, ladies. Is there anything else that you want to say that I haven't asked you about?
So I am going to champion the fact that I was accepted to UC Irvine's fellowship program for the MAT training trainer. So
That's
what
amazing.
will happen is while I'm receiving some additional education in treating addiction services or addiction patients, I'll be able to come back and help train some of the other primary care providers so that they can also incorporate treating patients with medications into their practice. It's kind of scary because for these types of services, a lot of providers aren't comfortable with the medications and treating patients. So they kind of, shy away. But I believe that with more education support, and being able to support other clinicians in transitioning into this, we'll be able to help way more patients.
That's amazing. Kudos. So you're doing this program soon?
Yeah. Actually, it is a 1-year program.
Oh, wow.
And so I'll be working closely with their physicians and their trainers weekly. And then there are several in-depth services trainings that I have to go to over in Irvine to the university a few times. But I'm really excited because I feel like this is ever evolving. So there's always something new to learn. There's always extra medications or things that can be added. Right now, we're limited in some of the addictions that we can treat. We definitely treat opioid addiction. We treat patients who have addictions to alcohol, tobacco, as well as some other benzodiazepines. But we have a lot of patients who are addicted to methamphetamines. And right now, there is a really small limit into how we treat those patients. So many other substances. So I'm really excited about learning all the avenues that are available to that. So I'm excited.
Great. Well, and then the winners are the patients who get...
The winners are the patients. Yeah. So we
get
get more clinicians on board. We have clinicians who are interested in learning.
You're still going to be seeing patients, though, at VCC during the time, right?
You're going to be busy.
I'm doing this on my off time.
You're going to be busy.
On my off time.
All right.
So this is totally something I'm doing just to kind of support my education. But when I did tell leadership at VCC that I was accepted to this program, they were really excited and they did offer some additional support. So I'm really happy. And then I'll be able to incorporate this into my practice, but also help other clinicians learn. So
well, it sounds like in addition to helping care for patients, that VCC cares for their employees too.
Yeah.
That's great. Okay. So at the end of every interview, I ask all of my guests the same few questions. So I want to ask you a book that you think everyone should read or a book that you recommend.
It's A Little Life by Hanya, Yanagihara. Okay. It follows essentially these 4 classmates that move to New York, and they all have these different backgrounds, different lives, different set of trauma, and follows them throughout the course of a couple of decades. It's a beautiful book. It's a long read, but it's well worth it.
Great. Thank you. I'm excited to check it out. I'll add it to my list. What about you?
Well, mine is not so inspiring. I just like, there's an author, her name is J. California Cooper. She's an African-American writer, and she writes short stories. The one that comes to mind is a book called A Piece of Mind, and it's just kind of a bunch of compilation of short stories told like you were sitting at your grandmother's feet listening to a story. So it's really plain and easy to read, but it's just it just feels like home. So she's one of my favorite authors, and I love her books.
Great. Thank you. All right. Joanne, what's your jam? What's a song that you love? A song you always have to turn it up, or one that makes you feel deeply?
My son will laugh really hard if he watches this, but anytime Prince's Purple Rain comes on,
oh yeah,
and I'm in the car, it's like turn the volume all the way up, especially the guitar solo. It's just kind of like my favorite.
Do you get into it with air guitar and everything?
Do you like turn your windows down,
yes,
like
and
let the wind blowing?
Yes, I get into it every time. Yes, I love it.
That's a good one. That's a good. I think we can all agree with that one. Okay, what about you? What's your jam?
Okay, so like I'm an amateur piano player.
Oh, that's fun.
Yeah, I've been playing since I was 7, but I'm not really any good. So the one song that I can play and like love to belt out singing is "Free Fallin'" by Tom Petty.
Oh,
like I can't even. I know it's like
I can't wait to hear
Free Fallin', but you'll never hear me play it for you. But
that's great.
It changes my whole attitude, my whole day.
That both of those I feel like are really good sing in the car songs.
Mm-hmm.
Like when you pull up at a light and you're just belting it out and the person next to you is like, what are you doing?
You're like, you know what I'm doing.
Yeah.
you know.
Come on. Let's go. Yeah,
you know.
that's great. I love both of those. Okay. Tell me something that inspires you.
What inspires me? Seeing positive changes in the world.
Yeah. It's inspiring and also uplifting, and kind of makes you be able to put one foot in front of the other when you see that positive change in the world, right?
Yes. And especially in places that you wouldn't expect it.
Yeah. I love that. What about you?
Seeing people succeed.
Mm-hmm.
And success for me is not always about dollars and cents, but being a positive contributor to the world.
Mm-hmm.
So when I see even someone like myself who grew up in an impoverished community succeed, being able to do something for other people, that's what inspires me. So it's kind of like a motivation why I get out of bed in the morning. Yeah.
So you are a equal opportunity cheerleader. You're cheering for everybody.
I want everybody to win.
I love that. I love that. We need more people who are universal cheerleaders, just cheering for, rather than universal grouches.
Oh,
Because we have quite a few of those. We could do without those folks, I think.
Yeah, absolutely.
Okay. Last question. Back to you, Diana. Tell me a business in Vista that deserves a shout out.
Okay, so when I first started working at Vista Community Clinic, I was right down the street at the Vale Terrace office.
Okay.
One place that was like my go-to for lunches, and I would buy everybody it for lunch, was Milk Organics.
Oh, yeah.
Love, love, love.
Great. That's a great spot. And they've expanded now. They have a bigger location
for them.
on Broadway. It's really cute in there,
All right,
too.
I'll find you.
Yeah, okay. What about you?
Curbside Cafe.
Yeah.
Oh my gosh. It is my all-time fave.
We're so food motivated.
What's your go-to at Curbside?
So if I go for breakfast, I call it breakfast lasagna, but it's an Italian omelet. It's got marinara sauce, turkey, Italian sausage, and spinach. And that coffee cake.
If I go to Curbside and I don't bring home a coffee cake for my kids, game over. They're so mad. They're so mad. But also Milk Organics, their Green Goddess sandwich.
Oh,
it's my favorite.
Good.
That's my favorite sandwich
so
there.
Good.
Mm-hmm.
So good.
It's a good one. So ladies, I want to thank you so much for being here. I really appreciated your time and your candor and learning more about the work that you do. What you're doing is so important. So thank you so much for joining me today.
Of course. Thank you, Rachel, for having us.
Thank you for inviting us.
Yes, thank you to our guests, Dr. Ponsford and NP Goode, and thank you for listening to Velocity. If you like what you heard, please subscribe wherever you get your podcasts and tell a friend. Help us move Vista forward with Velocity. The Vista Chamber of Commerce is a nonprofit organization that serves as a catalyst for business growth. Find us online at vistachamber.org.